So when we started, the first thing I usually start this class with is a little different because a couple of you weren't in the 2-day training. And I didn't want to have a lot of redundancy as far as reviewing stuff that we already did in the 2-day, but I also don't want the people that weren't in that training to miss anything or to, the overall concepts that we're dealing with. And like I said, I want to respect that you all are all very experienced, even if you're a little bit newer to hypnosis or to some of these techniques that we're talking about and medical hypnosis. Even if you're newer to it officially, your whole wealth of experience, that you bring to this allows you to do this work. You don't have to have, I started doing the medical immediately, and I didn't know that I was qualified to do it. But the results showed me that it's not about me as much as it is the intention. And like I said, keeping it simple, trusting whatever ritual, you might call it a technique or a ritual, right? Whatever ritual you're going to do with your client, if you do it with congruity, that whole thing about a ritual and congruity, if you do it with conviction and congruity, and trust hypnosis. You don't have to have 100% confidence in yourself yet when you do these things, because when you do something for the first time, even if you've been a hypnotist forever, when you are working in a class like this and you try on a new technique, by design, hopefully it feels a little outside your comfort zone. Like I said, if it doesn't, you're probably not learning anything. So it's by design. And the whole thing about having that client in front of you is then trusting it, whatever you learned up to now. Again, my now clock that I have, I refer to it a lot, because what counts is right now. With your client, of course, we're going to listen to their story. We're going to listen to the background, because that all gives us clues. Some of the clues it gives us is what they believe has happened and maybe caused their problem. Some of that will come from outside opinions that have been given to them by other people, maybe a long time ago, or maybe recently by some doctors or whatever. So we want to hear all those stories because it gives us clues. And yet the real basics are still there. And the first question I was going to say for this class is usually, what is medical hypnotherapy? Have you ever had anybody ask you that? I get asked that quite often, and it reminds me that sometimes you got to get back to basics and keep it simple for people. So let me put all of you on the spot first. What do you think medical hypnotherapy is? Anybody, just dive in. Yeah, Ajamu.
My elevator speech on medical hypnosis is as follows. Medical hypnosis is a collaborative process between a hypnotherapist and a medical doctor or dentist, where we help the patient to manage side effects of treatment and medication, as well as general compliance with medical compliance.
Nice. And because of some of the questions you asked last time, I'm going to ask you, when you work with medical referrals, are you literally working in the doctor's office or along with that person in the clinic or whatever? No,
I'm not.
Okay. So they refer people to you.
Yes.
And you work with them individually.
Yes.
Okay. I just wanted to clarify that because I was thinking of something you had asked at the last class that I wanted to make sure how I was thinking of this. Okay. Very good. I like that. Good elevator speech.
One of the things that I do is I virtually go into the clinic. So there's a clinic up in Albany, New York that does ketamine treatment. And when they're getting this infusion, they allow me to Skype in or Zoom in while the person's in this treatment. Nice. And I kind of guide them through this journey. And after the IV is taken out, they're kind of in a la-la land state. I help them to kind of make sense of what they were able to discover on that journey. I read back from my notes what insights they came up with. It's just like hypnosis. It's just chemically supported hypnosis.
Very nice. That's interesting, the way that you come right into the clinic on Zoom.
Yeah.
Or on Skype.
It's on the client's phone or laptop or whatever.
Very nice. That's really an interesting way to do it. See, y'all getting some ideas here. You can be there without physically being there as well. So anybody else have a definition, or it doesn't have to be a canned, something that you've memorized. Just what do you think medical hypnosis is? Medical hypnotherapy. Yeah, Lisa. We can't hear you again. Uh-oh. Can't hear you. Oh, well, we'll let her play with it. I could hear you earlier when you first came on. I was listening. We were talking. Anybody else have a way to define what? Yeah, Judy.
When people ask me, I usually say taking the emotion out of whatever diagnosis you have, so that you could, whatever treatments that you're going through, you can go through them with less stress and actually program the body to get the best of whatever treatment you're getting to use for your highest good.
Very nice. Very nice. Good things about medical hypnosis. I like all of these things you're saying. Anybody else want to throw one in? You're all so shy. Lisa wants to, but we can't hear her. I can hear you. You're kind of in the background, but I can hear you.
Hear me
Now it's lower.
now? What about now?
Oh, that's better. Yeah.
Okay, I had to unplug it, but then my battery will die.
Yeah, you're not loud, but if you can speak up, maybe.
So just a very simple, just allowing the body-mind connection to be better connected, so the individual can tap into their own healing abilities, whether it's physical, mental, just improving that mind-body connection.
I like that. Simple. It's something people would understand if you say it. Yeah. Anybody else? Anybody else got ideas on what medical hypnotherapy is? Okay, all of the above sounds good to me. And to oversimplify even more, if someone knows what hypnosis is, assuming they know what hypnosis is, I would say medical hypnotherapy is simply using hypnosis for a diagnosis with a medical referral. I don't feel like I do anything different, with very few exceptions, for medical issues than I do for anything else, because my belief system that seems to help me help my clients as it's evolved through the years, and with the great teachers I was fortunate to stumble in front of in those early years especially, taught me that it's all the same. The mind, the body, the emotions, the energy, it's all, we keep using the word holistic and integrative and all these words. It all goes together. If one thing is out of balance, it's going to affect the entire being, right? It's not just going to be that one thing. The other elements of the being may not be as affected as quickly or as noticeably for a while sometimes, as in someone that worries all the time and always fretting about everything and thinking about the worst possible what ifs all the time. They may not develop ulcers or other physical manifestations for a while, for a long time. But that doesn't mean that those changes aren't already occurring in the body. So to me, medical hypnotherapy in the simplest form is doing hypnosis with a medical referral.
So how do you differentiate medical hypnosis from clinical hypnosis?
I don't.
Okay.
Because clinical is a medical term. Where we really aren't. Now, again, the caveat is, if you're from other countries, please look into, with your organizations, they should know the laws. IACT, IMDHA, whatever organizations you belong to should know the laws as it applies to hypnosis. You usually, from my experience in this in America, I got very little information that was useful or accurate from local government agencies. They don't have a clue about hypnosis. We have to kind of, when I was in Camarillo, California, now you'd think California of all places is probably ahead of the game for stuff that other places might have still been calling woo-woo, right? And 29 years ago, when I started my practice in Camarillo, California, just north of Los Angeles, I went to get a business license because, you know, you had to get a business license to start a business in that town. And when I went to get the business license, they had the giant list of all possible professions, right? And I swear, the very, 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 very last thing on the list, and I mean, there were probably hundreds of occupations. The last thing on the list, now this is Camarillo, California, 29 years ago, fortune teller slash hypnotist.
Wow. Wow.
I could not believe what I saw. And I looked at the person there and I said, you've got to be kidding me. I said, who put this together? They don't have a clue what hypnosis is. This is embarrassing and insulting. So I made it my mission to educate Camarillo, California people about what hypnosis was. And I joined the local healthcare district and I started giving talks to the medical community because it was embarrassing, but I had to mark that was the only listing they had. They didn't have a clue. And many other places I've been the same way. So, you know, when I moved to Florida and I was having to get I don't need it where I am now, but there was one of the towns I was working in early on. I think it was Tampa, probably. And I went to get the business license or whatever occupational license, whatever kind of license it was. It had nothing to do with hypnosis. It had to do with just opening a business. And they didn't know where to put me. They didn't have anything on the list. And I'm like, really? You know, so I guess there weren't many hypnotists here yet, you know, 18 years ago. I really did have trouble finding one here. Now they're all over the place. So there you go. That's what I get for training so many people. No, it's like a magnet here. I don't know why, but I used to call it a vortex because as soon as I moved here, a whole bunch of people I'd known in the industry for years started moving here. Mm-hmm. It was really weird. Jillian Lavelle moved here right after I did. It was like, really? The head of IACT back in those days, the one that founded it. And it was crazy. So anyway, so check your local licenses, but be ready to, depending on who you're talking to, medical hypnotherapy, you know, is using hypnosis. We use hypnosis techniques, right? And I will tell you, if you haven't already discovered this, any technique that you learned in your basic or your entire hypnosis career or that you can find, I would say practically, if not all of them, can be adapted for health issues. Mm-hmm. And sometimes with very, very tiny modifications. Now, that doesn't mean we do exactly the same thing with a smoker, with weight or stress as we do with a medical issue. I think we approach it with a little bit of a different attitude because it's a different kind of a mindset going on. When somebody walks in with a diagnosis and a doctor sends them to you. One thing that I think is a benefit, if a doctor is sending them to you, it increases your credibility instantly. So if you're brand new to this, and like I said, my first year, I started getting doctor's referrals and I was studying this stuff with a bunch of people in Arizona and California. And, you know, my confidence level wasn't built up yet as far as what I could do, but I was confident that I had some good training. And like I said, fake it, you know, act like you're confident and it'll come across, and keep out of your own head and just remember to look at your client and just really want to help them. And that gets you out of your own stuff and you'll be able to help them. If they trust you, you can help them with whatever you know up to right now. So anyway, so I forgot where I was going with that again. I get excited when I talk about this stuff. So, and it's not because I'm getting older. I keep reminding myself because I look at videos from 20, 30 years ago. I was the same way. So it's all the same. Jamu, are you laughing at me?
No.
I know it's hard to believe that I used to play Ditsy Blondes, isn't it? I mean, It's crazy. I'm such a dramatic actress. Okay. So all I'm saying is you already can do it. And the elements that you work with a medical issue are going to be a lot of self-esteem, self-love, self-care, and what the indelicate term that is used in hypnosis, ego strengthening. Sorry, but that's what they call it. But that really is what it is. It's getting the person to feel empowered. That's what we do with hypnosis, right? And you can do exactly with any medical issue. Like I said, you don't have to know everything. I do recommend if they come in with something you're not familiar with or you haven't heard of before, you don't have some knowledge of. And by the way, Eric's going to do a little bit more expanded on the DSM, which I think it's been very useful to me. Something I didn't think I would ever be interested in learning more about, but he makes it interesting and it is useful. And it helps us to know what questions to ask. So, like I said, anything that comes in, you can work with because the basics are always the same. And I'm gonna, so as far as defining medical, I think it's nice to have that little short elevator speech, especially have one if you're going to be interacting with doctors, which you will be, or medical professionals that are going to be referring people to you, because you want to talk intelligently about this. You know, and I love all the ideas. You're giving me more ideas too. And I love the idea of explaining to a medical professional, you know, hypnosis has a way of accessing the part of the human that can bring the mind, body, and, you know, all of the aspects of their conscious and unconscious together and tapping into their, you know, innate abilities to answer questions, to get answers to their questions, to find maybe some underlying issues that aren't immediately apparent to that person on a conscious level, and can sometimes clear some emotional things that can aid in the healing process, that can help the person to heal. Okay, so medical hypnotherapy is basically, we're doing hypnosis, pretty much the same things, but it's nice to have some specifics. And like I said, if something comes in you're not familiar with, first thing I do is go on the internet and start doing some research. Because the first thing I want to see is that people have recovered from it, that people are surviving with it, maybe, you know, whatever. I want to find anything that's going to be hopeful and helpful for that client to know that there are possibilities. That's where I think we have the edge on the rest of the medical team, because we are all about outcomes and possibilities and creating more options for the client, giving them hope. And just by design, the rest of them have to be telling them worst case scenarios and all these things. And you know, you have this because of, and they're giving them all of their reasons. This reminds me, I was going to show you a piece that this is a powerful piece, I think, that I do in my hypnosis training. But since none of you have taken my hypnosis training, I can introduce you to a couple of things that I find to be very powerful. Oh, that's not what I wanted to show you. Well, as long as this is up here, I'll show you this. Can you see that?
I love your logo.
Oh, thank you. I created that 29 years ago.
It works.
Very simple, and some kind of a weird word thing that doesn't exist anymore. I don't even know how I did it. Can everybody see that? I can't see you guys now. I don't know why it does this.
Yes, we can see it.
Yes.
There we go. Now I can see you guys. Okay. I like to see you all. Okay, I can't see all of you at once, but at least I can see some of you. Okay. This is my letterhead that I usually put it on a nice, like a linen kind of, you know, expensive paper. This is just the template that's on my computer, but it's changed through the years. Obviously, I used to have at the top the Better Business Bureau for until about 5 years ago. I was a member of the Better Business Bureau in California, and when I moved here, mainly because none of the other hypnotists I was meeting were members of it, and I thought it, again, credibility, right? I'm a professional business person. And I had that, and I belonged to 2 or 3 chambers of commerce at any given time, and I would have their logos, you know. I was an ambassador for the Chamber of Commerce when I moved here. I had that on there. So it's changed through the years. Now since I'm mostly a trainer and I let go of some of those things because it was just money, I decided I didn't need to be spending on that anymore. So I've got that I'm a member and certified master trainer of IACT. There's the IACT logo. Then I've got IMDHA approved school, and I'm a life fellow with IMDHA. Thank you, Paul Durbin. That's all because of him. Lovely man, if you aren't familiar with him. He's gone now from this world, but he lives on in my memory. International Alliance of Hypnotists. Again, if you're a member of IACT and IMDHA, you get that third membership of that IAPH, International Alliance of Professional Hypnotists. So again, if you want to look professional, the more of these that you belong to. Certified instructor for International Hypnosis Federation. Of course, that's Shelley Stockwell's group. And then I'm a lifetime member of this little Florida group I've been talking about, the Hypnosis Education Association. And I'm right now the vice president, and I'm a past president of that group. So here's a little simple letter. And this is years ago. I mean, what, in 2006, this copy of it is. But I haven't changed it much in all the time I've been doing this. I very rarely need to send this to doctors anymore because usually the person will bring in the referral. This is just a sample though. And again, very simple so that they can understand it, because doctors don't have time to read this stuff anyway. They're going to glance at it and their assistant probably is the one that's really going to be reading it. And I just say, your patient, always your patient, not mine, it's my client. And again, depending on the laws in your country, your patient blank has come to me for stress reduction to assist with pain management associated with her current conditions. She has informed me that you're her treating physician. The adjunct techniques I will be employing with your patient include progressive relaxation, guided imagery and visualization, positive post-hypnotic suggestions, auto-hypnosis training, and ideodynamic techniques combined with all of the above, because that sounds really cool. And now they know I'm going to be doing hypnosis. They already see I'm a hypnotist. It's all over the place. But I don't step on any toes here. We do have, and the first thing we're going to do is stress reduction, right? My personal opinion, by the way, if I haven't already said that, is that no matter what walks through the door, I'm dealing with stress. Absolutely. Because if I wasn't, they would have already figured out how to solve their problem or take care of whatever's going on. It's always stress. The less stress they have, the better state they're in, because we're about state shifting, right? We get them into a healthier, less stressed state. And guess what? The body heals faster. If it's possible. Okay.
Patty, this is
Yes.
scary.
Yeah.
Ideodynamic, what? I'm sorry.
It's a big word.
Yeah.
It's a big word. Ideodynamic is okay. You all know about a pendulum, right? The pendulum, right?
Mm-hmm.
The pendulum is the basis of the electro and whatever. What's that thing that's the lie detector? The lie detector machine was based on the pendulum idea. When I learned that, then I thought, oh, pendulums aren't all that woo-woo after all, are they? Because what happens if you don't consciously move the pendulum and you think a thought and it starts moving, like this one is now, and I didn't even know I was doing it. There's ideomotor little responses, micro-muscular responses in your fingers that are causing it to move based on the thoughts that are going from your head to your little tiny muscles. It's the same idea of what they're using with quadriplegics. I think we were talking about this the other day. That might have been a different class too, so forgive me if I repeat myself. Got a lot of classes going on right now, but they're working with quadriplegics now, and they know that they can get them to imagine moving their legs that are supposed to be immobile, and they're getting micro-muscular movements.
Wow.
They're starting to get movements. It's the coolest thing in the world. That's what ideomotor means. If you've ever done a class where you're getting finger twitches, little finger responses, there's a whole book that I have somewhere here. Is it right there? It's in the other room with all my other books. And it's Ideodynamic Healing, I think is the name. It's one of the big, great books. I think it's by Walters. And are you familiar with that one, Ajamu? Walter,
No.
I think it's Walters and somebody. Anyway, it's a whole giant, but it's as big as this one. And this is the other Bible. If I haven't shown you this yet, Clinical and Experimental Hypnosis by Kroger is probably the most quoted book in medical journals. I mean, Kroger is everywhere.
Yes.
It's a great one. Two of my course study projects were based on this book. And probably some of the stuff that's in your manual came from my research based on this book. Pretty cool stuff. So that's a great, and it's not a hard read. I mean, if I can get through it, I think you all can handle it. You know,
Can I add something, Patty?
Yeah, absolutely. Please.
This Kroger book is amazing. It is, like you said, the most used, most sourced book on hypnosis ever. And
Yeah.
that's I think that's the 1980s or 70s version. There's an updated version of it.
Oh, yeah, this is probably an older one. Yeah.
And the cool thing about that is that it includes DVDs of
Ooh.
Kroger doing hypnosis for natural childbirth and for a laryngectomy. So going in and slitting someone's throat and removing something that shouldn't be there.
Oh, now I got to go buy that. Now I
Oh,
got to go buy that one.
It's
Yeah.
about $100.
I'm sure it's worth every
Worth
penny.
It is
Yeah.
worth it.
This was a lot of my early education in the medical side of this. I just opened randomly, just as an example, right? Just to give you an idea. It's not just technical stuff in here. And I just opened the book randomly, and I'm looking at a section, a little part of it here called post-operative verbalization for dehypnotization. Okay. And I'm looking at one of the suggestions here that I've got highlighted. You will find that the period after your operation will be a very pleasant one. Should you have any discomfort in and around the wound, you may use glove anesthesia, which you learned to develop to knock it out. Love this. And it says you will be able to relax and sleep soundly. Should you require medication for sleep, it will make you very sleepy. So see, we can help the medication again. And Dr. Rosen's always really, really emphasizing this. And I've always been this way too. We can help the medicine work better. One of the first things that the Mayo Clinic and all of them were talking about many, many decades ago, where hypnosis was useful, one of the first things that was out in the general public was that it's great for the side effects of chemotherapy for cancer patients. That was one of the first things that really got well publicized. So know that we can, when we say we're part of the team, we want to emphasize these kinds of things with the doctor. We can reference these kinds of books. This is a clinical book. The doctor doesn't want you referencing, with all due respect, Dr. Krasner's The Wizard Within. Okay, as much as I love it and learned a lot, and it's still a great nostalgic book. But when you're talking with doctors, have some references. So anyway, and then after this stuff, I put in here that I've enclosed a short bio listing my credentials and certifications, documenting that I have extensive training in these areas. I would like to have your permission to work with Ms. What's her name in accordance with the laws of the state of Florida, Statute 485. That rolls off my tongue like I learned that immediately. It's the only law in Florida that applies to non-licensed people using hypnosis with medical issues. I think it's a very friendly law. It's very similar to the California. It's almost exactly like the California law. And I think most of the states have similar laws. Again, check with your own area. And I'm going to show you the wording on the Florida law when I get it, because even then people will interpret them differently. So talk with your organizations, because they have lawyers that can definitely be sure, make sure that you're working within the Mark Babineau is the one that does the ethics course now for the hypnosis trainings that we're doing through IACT and IMDHA. And he's a lawyer and he's at the conference every year. So he's a good resource to interpret legalese, Anyway, And then I say a simple written referral written out as a prescription will be sufficient to show that you are aware and approve of the use of these complementary techniques. Always respecting. I'm not going to go step on their toes. I'm going to make their job easier, and they're going to love me and send me more people. Thank you for your attention and consideration, blah, blah, blah. And that's, there you go.
Well done.
It's very simple. It's very simple. And that's, you know, like I said, they don't, that the bullet points, you know, that's really what they're going to look at. And, oh, I can just scribble it out on a prescription pad. So.
Patty, I have a question about
Yes.
ABH. Is
Yes.
that still a thing that we can put down on documents? I know that was 06, but does ABH still exist? I know they don't have a conference, but is the organization
ABH?
still?
Oh, because I had my registration number down there.
Yeah. Is that still?
American Board of Hypnotherapy is fine. Now, I can't say for sure, but as of within the last year or so, I was hearing they were still around.
Okay. I
But
wasn't.
now that Tad's gone, because I think he was still running it, wasn't he? So I don't know now. Something may have happened since then, so don't quote me.
Okay.
Patty, I have a question. This
Yes,
is
ma'am.
Carrie again. What are our actual credentials as a certified? What are the letters for the certified hypnotherapist and then certified?
Yeah, each organization, you know, and when people create programs, they create their own. So I just created it as CMH. I was going to put the H with the little T, but I thought that's just, so I just have capital C, capital M, capital H.
And then,
I like it.
okay.
Yeah,
right.
just
And
keep
then
it simple.
And then for regular, you just use C.HT, I see. Is that right?
Yeah, and I've seen people use capital C period, capital H period. Like I said, each organization has a little bit of a different bent on it.
Okay.
CHT, the capital C, capital H, small t, I think is more widely used. I've seen that more than anything else through the years.
Uh-huh.
And that is what IACT and IMDHA uses. But capital C, all capital CMT is, I'm sorry, CMH. And there's going to be other things. Like I said, there's one of the things that one of the acronyms ended up being the same as a certified hand therapist. One of the, I think it is that CHT.
Mhm.
Yeah, because some people use all capitals CHT for
Uh-huh.
a certified hypnotherapist. And that also is an acronym for certified hand therapist, I found out. So, you know, there's only so many letters in the alphabet. So
Thank
have
you.
to keep it in context. Okay, I'm going to show you real quickly now. Just for your reference, this is the Florida law. I don't think anybody in here is from Florida, right? On this call? I don't think. But like I said, this is almost exactly the same as the one in California. And it's the only one. And I get into, like I said, discussions with other people about this all the time. But I've checked with at least 3 lawyers that are also in the world of hypnosis about this through the years. I am 100% confident that I'm interpreting this correctly. And it just, to me, it's common sense. Okay. So I think it's very friendly. And I think most laws are, because all they're saying is it's recognized that this is where people get stuck. Hypnosis has attained a sufficient place, a significant place as another technique in the treatment of human injury, disease, and illness. I love that it says that. There it is. Hypnosis. It's attained a significant place, both mental and physical, that the utilization of hypnotic techniques for therapeutic purposes, that's called medical hypnotherapy, should be restricted to certain practitioners of the healing arts. That's where people stop reading, I think, that want to argue with me. Because a little, you see, I've highlighted, this is my highlighting here. And because it says or, the or is very important. That includes me now, because I'm not licensed medical professional. Or that such hypnotic techniques should be employed by qualified individuals who work under the direction, supervision, or prescription of such practitioners. And I've talked to a lot of doctors through the years. I've trained a lot of doctors through the years, medical professionals, mental health professionals. They don't have time to direct and supervise you. Trust me. They will give you the prescription. They will give you the referral, in other words, and they're done. And if you want to give them a little feedback, it'll go in the person's file. They probably won't have time to read it. And I've asked them, do you want me to give you feedback? And they'll say, I don't have time. Okay. But if it's in their file, they'll see it and they'll think of you more often. So I think it's a good idea to send a little note, to the referring physician, at the very least, a thank you note, and maybe a little follow-up saying, my overall observation is a nice way to frame it, and be very benign. Don't say anything that sounds like you're diagnosing or interpreting or any of that. Just keep it very benign. This person was a wonderful hypnotic subject. We're not supposed to use the word subject anymore. I don't know what else to say. Hypnotic client was a very good hypnotic client, and was able to attain significant relaxation. If I did a pain scale, I can add that. I can say from the beginning of the session went from a whatever to a whatever, but nothing that sounds like I'm talking about symptoms or any of that kind of thing, other than that they reported that they felt better. And my overall observation is that they're going to be practicing self-hypnosis and making further progress or something. Just keep it simple. Later on in here, it says hypnotic techniques shall be used only, again, by certain practitioners of the healing arts. And again, that all important, or by qualified persons to whom a patient may be referred. Now, I think somebody was asking about, the healing arts. In Florida, healing arts is an umbrella term they're using in the Florida law that means anybody. Basically what it means, my interpretation and what I get from all this, someone who's licensed to treat somebody for something. So they include, shall mean the practice of medicine, surgery, psychiatry, dentistry, osteopathic medicine, chiropractic medicine. Remember I said I get referrals from chiropractors. I can't read some of these. Some of these are words I don't want to try to pronounce. Anyway, clinical social work, marriage and family therapy, mental health counselors, all those things, optometry. So as long as what the person is being referred for is something that licensed person is, treating them for, or has diagnosed them with, or is licensed to deal with. Because people go now to chiropractors for pain issues, right? So I can literally take a referral from the chiropractor who's treating someone for pain under their licensure. As long as they're treating them under their licensure, they can refer them to me for additional help with that. And that's the way Florida does it. I think that's the way most people do it. And it says practitioner of the healing arts, it says what that is. Somebody licensed, in other words, to treat someone. We don't treat, remember? We don't treat, diagnose, or prescribe. I would say that's probably true for anybody in any country. There may be some exceptions, like I said, in other countries. I don't know. But it says within the scope of their practice, they have to be within their scope of practice with that patient. And then they may refer a patient for treatment by a qualified person who shall employ hypnotic techniques under the supervision, direction, prescription, and responsibility of such referring practitioner. What they care about is liability. That's what all the laws are about, because we're not licensed. They can't figure out what to do with hypnotists. We don't treat, prescribe, or diagnose, so they don't know what to do with us. And they got to have somebody with a license that's responsible. That's the bottom line. In case there's some liability issues, they're the one that'll get sued. That's basically what it's about.
Would you want to mention in this document that you have insurance?
In what document?
In this document that you send out, would that be helpful to indicate to the doctor that you have liability?
It doesn't mean anything to the doctor, though.
Okay.
Liability insurance is CYA for us.
Right, but it makes us look more legit. That's
yeah,
all.
you could, sure. Why not? Yeah, anything that adds to credibility, sure. Go for it. Okay. And it says it's unlawful to practice hypnosis for any person to engage in the practice of hypnosis for therapeutic purposes, which is why don't use the term hypnotherapy with someone that, you know, doesn't require a referral. We're not doing therapy, hypnotherapy. We're doing hypnosis. So make sure you understand that. So if you're working with sports performance, you're doing hypnosis. You're not doing hypnotherapy. Hypnotherapy is when you're doing therapeutic hypnosis. Therapeutic purposes, unless such person is a practitioner of one of the healing arts or acts under the supervision, blah, blah, blah. That's in there every single time. And it says the person is qualified based on the referring licensed person. They're the one that determines that you are qualified to refer someone to. So you could just have started your hypnosis practice yesterday. And if a doctor trusts you and thinks you're qualified, then you are qualified to do therapeutic hypnosis with one of their patients. That's simple. I love it. I think it's very helpful because it legitimizes us. This whole thing to me legitimizes the field of hypnosis. It says right in there that it's helpful for treating human injury, disease, illness, and mental and physical stuff. How cool is that? It's right in the Florida law, and it's probably in the laws in your area. So any questions on that?
Yes, please.
Yes.
I went to a ABH conference years ago with Stephanie Jordan. Do you remember her?
Yeah. She used to
National
take
League.
insurance.
Yeah, National League of Medical Hypnotherapists. And she talked about this number 90880, which is the insurance code for hypnosis. And her premise was you take out an ad and for, whatever, IBS. And then people call and then you send them to a doctor. You have 2 or 3 doctors in your Rolodex, but you know that they're open to hypnosis. They go to see that doctor. Now the doctor gets something out of the deal because now they have a new patient. And then he or she prescribes a certain number of hypnosis sessions to that person for hypnosis. So that's really the benefit to us, that he or she will say, well, I think 8 sessions to start would be good. And then
that's great.
You do the 8 sessions and then you send them back to the doctor, and the doctor evaluates them again and says, oh, it looks like you need a bit more. How about another 4 or something like that?
Right.
Have you done it that way?
I haven't done it exactly that way, but what a great way to do it, right?
Yeah.
Because usually if somebody comes with IBS or something, they've already been diagnosed. They usually, if they're diagnosed already, then they probably have a doctor already, right? Which is fine. And that's a new connection. So that's good too. But if somebody comes and they haven't seen a doctor, like you said, we're not going to work with someone that should be diagnosed. And we have to be careful how we frame that even.
Sure.
Like I think you need to see a psychiatrist. That's kind of like diagnosing, isn't it? We got to be careful how we do that. But it's like you said, it's really good to make. That's why I said go to grand openings of clinics. Get a badge. Get a badge. This is based on the Chamber of Commerce badge that I had when I first moved here. I liked it, so I made one that had hypnosis big on it. And go to events where doctors are. Go to the hospitals. Do free talks. Doctors do talks. You'll have 3 doctors in one day that are going to give presentations open to the public. Show up, and during the breaks, go up and introduce yourself to the doctors. Make yourself part of that community, because it'll start filtering out who you are, and have your cards. Of course, always have lots of cards. And like I said, the best way to network is not to walk up and hand somebody a card, which is what everybody in the Chamber of Commerce does. And it's very annoying. It's very annoying. So walk up and ask them, or if you go to a trade show, I do the same thing at health fairs and things. Walk up and ask them about what they do. This is really interesting. Tell me more about this. Where do you practice? What kinds of patients do you treat? And if you have your badge on that says hypnotherapist, medical hypnotherapist, guess what? They're going to ask you. It's so much better when they ask you. Now, you know they're interested. You're not pushing it at them. It always happens. Trust me. Wear a badge and you will get asked about what you do all the time. And it's not tacky, it's professional. Okay. So let's see. I don't know if Eric is going to be coming any minute. So let me show you a couple more little things. Oh, here's a cool thing. Ajamu probably knows this guy, Juan Acosta.
Yes.
Oh, Juan Acosta works. Oh, I forgot to hit share again. I'm looking at it. Can't you see it? No. Okay. Probably not. Okay. This is a little thing that Juan Acosta put together. And what he does is he has this little notepads made up. And he drops them off he works with mostly dentists. He drops them off at dentists' offices. And, it makes it easy. They just fill in the person's name. Probably their assistant does actually, fills all this stuff out and then sticks it in front of the dentist's face and says, here, sign this. We're gonna send this person to the hypnotist. And they check off what they're sending them for. Bruxism, cancer care. People get mouth cancer, right? This is all based on dental, but you can make up something like this for medical. And I would put, if it was mine, of course, you're going to see my logo right at the top.
Mm-hmm.
And well, actually, I might not. For this, I don't know if I would or not. I don't know, because this is for the doctor to send them to me. But yeah, I guess I would, because it's sending them to you. Or at least have your name at the top, medical hypnotherapist. I don't know why he doesn't have his name on here. Anyway, this is an idea. You can have little notepads made up at Office Depot or Staples or somewhere like that.
What size is this? What by what?
I think it was like just a smaller, maybe a little bit, maybe 5x7 or something like that. It's what I'm remembering. I could be wrong, but that seems like that would be about the right size for this. Doesn't need to be any bigger.
Mm-hmm.
So that's a nice little piece. Makes it easy. They just check marks, put the patient's name in, doctor signs it, and the assistant fills in their phone number and all that other stuff.
Patty, would you be able to send us this, or is this something that's not for sharing?
Yeah, Juan Acosta is very, very generous.
Mm.
He invited me to join it because I've gone to some of his other ones. Do you go to those, Ajamu, ever?
I hadn't known about that, but I have his book. I highly recommend it.
Yeah. Is it called Hypnodontics?
Yes, it is.
Yeah. Juan Acosta. He's at the IMDHA conference practically every year, I think, and he does a lot of really cool stuff. Very cool.
Good to have a niche.
He did some kind of a conference a while back, and he asked me to come on, and it was for dentists. It was something he was holding for dentists, and he actually asked me to come on and give a presentation. It was the coolest thing in the world. So he does a lot of nice stuff. So look him up, Juan Acosta. You all are members of IACTR IMDHA. They have, like I said, sample referrals on their website. Here's one that you can just take the idea of it and put your name and your address, your company name and all that. A physician referral. This is a nice little simple form. Your patient, so-and-so, wishes to receive hypnosis services for the following, and you're going to fill that in. In such cases, I require a referral. Your name's going to be there. And then the doctor, any instructions they want to give you, just basic stuff, right? These kind of forms are on their website in the virtual library. And then there's one more here that's, you can get complicated with these things. I think it's better to keep them simple. This is a sample one that a lady donated for people to use. And it's very intricate. In my opinion, it's a little too much information. She talks about trained and certified through Omni Hypnosis Center and Cal Banyan and blah, 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 blah. And, she's got her whole credential thing in the group she belongs to. That's fine if you want to do that. She's from Rochester, New York. Not licensed by state governments, she says, which is pretty much true, I think.
So this is in the virtual library?
This is one that she donated, and they sent it out from DHA a couple of years ago. I assume it's in the library. Yeah, I'm pretty sure. If not, I can send you these things too. So, okay, that's enough of that. And they might even have more of them in there now. I haven't looked lately, to be perfectly honest with you. Okay. And then, but the most important thing is the consent and release. My intake form is very short and sweet. Like I said, simple. The things I want to know is emergency contact. I want to know their name, address, blah, 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 date of birth. Emergency contact in case they have an episode while they're sitting in my office. I have them fill this out even for free consultations. Right at the beginning, they're going to fill this out. How did they hear about me? I want to know that. The goal for the visit, I want to see how they frame it, of course. What are your expectations? And then, are you presently in treatment for any condition? So this is the generic one. I give this to everybody. If it's already a referral, I'm going to know they're in treatment, you know, and they'll still circle that. And then they're going to tell me what that is. If they're coming for smoking cessation and they circle that and say, I'm under the treatment of a cardiologist because I just had open heart surgery, you know, it's nice to know that. So we'll talk about that. And then I ask everybody to provide your, and here's how I say it, provide your doctor's name and number for consultation and follow-up if necessary. Right? And then they all do it. So now I've got a doctor's contact in connection. So even if I'm seeing someone for smoking, you know, when they succeed at quitting smoking with me, I have their doctor's name. Guess what? They've already, and when you see this is why I have the disclosure consent form written the way it is. They already have given me permission to contact their doctor if I feel it's appropriate. And if they are seeing a cardiologist and I just help them quit smoking, I think it's appropriate that I send a little note to the cardiologist saying, your patient so-and-so came to me for help with the smoking cessation and successfully eliminated the habit of smoking with me with a follow-up of, 2 months or whatever it is. And now you're in the file. So the next smoker that cardiologist runs across, he's probably going to think of you, or she or he, or whatever the appropriate designation is. And here's the important part. Okay. Now, if you can't see all of this, you'll have to move the pictures up to the top or off to the side or something. Can everybody see this? Disclosure consent. I put a lot of time and effort in this, so feel free to plagiarize me, please. I hereby state that, and I say check 1, read and sign below. I have no physical or mental conditions that would make it inappropriate or inadvisable to be hypnotized. Most people are going to check that. Or I have furnished a referral from my treating physician / health professional to use hypnosis as an adjunct therapy for my conditions. Okay, so one of those is going to be, and then everybody sign, like I said, everybody gets this. Even when I do groups, I have a shorter version, but it's got this on there, exactly the same thing. Patricia does not treat, prescribe for, or diagnose any condition. She is a properly trained facilitator of hypnosis and is not practicing any other profession that requires a license under the laws and regulations of the state of Florida. Now, if that applies to you, of course, you would say that. If you are a licensed nutritionist or something else, then you'd have different wording, obviously. Hypnosis is not a substitute for medical or psychological treatment. Hypnosis for subclinical purposes requires no referral. She only practices therapeutic hypnosis within the guidelines of the law in Florida Statute 485, which requires a referral and oversight from a licensed practitioner of the healing arts. By signing below, I state that I have read and understand this disclosure and give consent to be hypnotized for the purpose of helping me to accomplish the goals I've described above. If I am scheduling multiple sessions, I understand I'll be charged for any session canceled with less than 24-hour notification, which I have never done in my entire 29 years. I just forgot that was on there, frankly, and I just don't do that. I also understand that Up High offers no refunds and only credit for any unused portion of any multi-session program. I further give permission for Patricia to record my session and to discuss my case with my physician if appropriate. There it is.
That's excellent.
Everybody signs it. I think I've got everything covered there. Anything I ever want to do now. The one thing that I just realized I don't see. That's funny. Oh, it is on there. I further give permission for Patricia to record my session. I was going to say, I thought for sure I had that on there. And to discuss my case with my physician if appropriate. Who decides if it's appropriate? Can you guess?
You do.
That's right. You're the expert hypnotherapist. You're the one that's going to decide whether it's appropriate to discuss. And they've given you permission now. So everything's cool. Everybody's on board. Everybody's happy. Any questions on that? Like I said,
Yes.
Feel free to copy as much or any of that that might be useful for you. But do cover yourself. Somebody have a question?
Yes, I have a post-COVID question.
Okay.
So what if you get a call from someone from Louisiana? How do you handle those kinds of intakes since all your stuff is kind of...
That's been an interesting conversation. Michael Watson has done a lot of Zoom trainings, and that's always something people ask. What if someone's in another country, another city? I have been handling it pretty much the same way.
Me too.
If the person says they're in treatment, I'm not gonna work with pain relief on Zoom unless I have a referral.
Right.
So they can have I will take an email from a doctor because, like I said, in 29 years, nobody's ever knocked on my door and said, "Where's the referral for you working with this person?"
Mm-hmm.
But the one time I don't get it, you know what's going to happen, don't you? The Murphy's Law, right?
Right.
So I always get it, and I will take an email. I will take an email, from the doctor's office. I'll just save the email. I'll print it out and put it in their file. I don't worry about it. If you walk around with fear, guess what's going to happen?
I think the thing that works to our benefit is that we're not licensed by the state of Florida, or in my case, New York. And because my therapist, I was visiting my sister in Oklahoma, and my therapist couldn't work with me and couldn't send me medication because she's not licensed in that other state. But
Right.
In our case, if someone calls you from, Boca Raton versus Boston, it doesn't really matter because you're not licensed in either place.
Right.
You're presenting yourself in the same way,
Exactly.
regardless of what state you're in. I just wanted to
And
know
other
your
countries, if someone wants to do a Zoom session with you from Australia or Hong Kong or whatever, again, we're not licensed. I love that we're not licensed. I hope they never, ever, ever get that bureaucratic machine going for hypnosis, because we're not going to be able to be as effective, I believe. And there's no reason to license this. We don't do anything invasive. Yes, we can have some hypnotists that are less technically proficient at performing their job. But the worst case that will happen is like some people that have come to me that somebody took them on a past life regression and opened up a can of worms, and now the person's upset thinking something's wrong with them beyond what they started out with. That's not good. And that just means that person isn't very skilled. And that usually happens, by the way, with a psychologist or someone in the mental health field that has minimal training in past life regression or hypnosis, right? So generally, we are trained how to watch for things, and online, I'm amazed you can see it online too. So you can see if the client is having a problem, and you can say, okay, step away from that, step back from that. We know how to dissociate our client, and open your eyes and come back out here with me. And if you're working with certain things, we can have those safety valves. We can create a safe space. We can create certain words that can trigger them to come back into safety, back into associating into the safe place with us. I don't worry about those kinds of things. But as Michael Watson would say, you do want to prepare for them. You want to be ready to not freak out and panic yourself. As long as you stay I talk about that bubble, me and the client. When I'm doing clients online now, I'm starting to really enjoy seeing clients. I saw a young gal the other day that I had worked with personally, probably a year or two ago it's been. And we did an online session and it was beautiful. And I could see what was going on with her. And I think of this bubble. It's me and the client in the bubble. I use my anchor, which is the breath and the fingers and thumbs together. That's it. The Star Wars shield goes up, but I can now perceive that person even more clearly from that peripheral, like that little exercise we did that first day in the 2-day training. You remember that? Y'all, Ajamu, I know you're familiar with going into the peripheral, right? Opening up your perspective. That's the learning state. And it allows you to detect more little clues from your client. Those nonverbals will start to pop out and you'll get more information from being out here than you will if you're really focusing like this. So, keep that expanded mind. And I think of it as a bubble, that the world is still there. I still know it's there. If the fire truck comes to the office and starts banging on the door, we're going to know, and we're going to be very focused to deal with it, probably better than usual, because we're in a hypnotic process, right? Hypnosis makes you more focused. It makes you more aware. It makes you more efficient to deal with what's happening. That's why it's so great for us to teach our clients self-hypnosis, to practice. If someone's dealing with a health issue, especially if it's a catastrophic thing that's happening with the person. And by the way, if it's happening to them, it's catastrophic anyway, because, we live in our own center. And if something is happening to our physical body or our emotional self, it's invasive. It really affects our life. It affects everything. So we can help these people to empower them. Like I said, the doctor's office has to give them worst case scenarios and all those reasons why they have what they have, or their opinion of what they think the reasons are, which may or may not be accurate. We don't have to do any of that. We can just make them feel better and give them hope, as Michael Elner used to say. Mm-hmm. Our first thing we do for our client when they walk in is give them hope. When they walk out of our office, it's unique because it's the only person that's dealing with their problem, their physical or mental problem, where they actually feel better when they leave than when they walked in. That's an amazing, wonderful thing to be able to do for people. So, love what you do. I know you all do. And I'm going to show you my little Y chart that I do in my hypnosis training. And this came out of work with originally started with Tad James.
Rest in peace.
What's that?
I said rest in peace.
Yeah. I keep forgetting. Yeah, you're the one that told me. I haven't looked that up to see. Do you know how he died or what?
No idea.
What it was? Yeah, I learned a lot from him. But this all started with him when I studied timeline and a whole bunch of other stuff with him through the years. NLP, of course. He's really big into NLP. And it evolved through the years. And when I started training, it became a training tool. And it's in my hypnosis training now. To me, this is, again, simple, really your unconscious gets it. People walk into our office with a diagnosis. And this is only for us, by the way. We're not going to tell our client any of this, per se, the way I'm presenting it to you. But this is, to me, just cut and dried. It's what we're doing with our clients. They're walking in as a victim. And I looked up a couple definitions of what is a victim. It's a person cheated, fooled, or injured, or it's a living being offered as a sacrifice in a religious rite. I found that to be quite interesting. So they walk in on the victim side on some level, or they wouldn't be coming to us, trust me. And that means they are the effect of whatever their diagnosis is. And according to the doctors, usually there's something to blame, and there are reasons why they have their, problem, perceived reasons, maybe that they have decided, or, I get headaches because of my ex, maybe they've decided, or I have this back injury because that idiot ran that red light and I was being perfectly lawful going through the intersection and that idiot ran the red light. And that's why I have all these problems now, and my back problems, and I can't do what I used to do, and I can't work, and my relationships have gone south, and my financial problems that I have. It's all because of these reasons, right? And the thing is, on this side of the equation, all those reasons and all those things, events and people that are to blame, means that the person walking in the door is powerless. And by the way, those reasons and all of those things that they're blaming or people they're blaming may be 100% accurate. That idiot really did run that red light years ago and started all my problems that I have today. Yes, it's true. It doesn't mean they're not valid. And this is where, as a hypnotist, I think you can really, really help yourself to get really good at this by practicing getting the judgment out of your head. Getting judgment out of your head. In other words, the reasons are valid. Reasons don't help us to help our client, though, do they?
Right.
And these are the people that are going to probably be in support groups. And please don't get the impression that I think all support groups are not useful. Because I just know somewhere out there, there's probably one that is a good one. Most of the ones that I have experienced attending and speaking with are supporting the reasons. Because after all, it's understandable. And it makes sense that people would be supported and people would feel sorry for and want to help the person who was perfectly legal going through that intersection and the idiot ran the red light and plowed into their car and gave them all these problems. It's understandable that you're miserable now. It's understandable that you're in pain. So they get a lot of support for the reasons, but they're still powerless. It keeps them weak, which makes them afraid. And it makes them only react to follow. The circumstances are guiding everything that happens. They're constrained, they're unmotivated, apathetic. They're limited. I don't like that word. I like that other word, right? And they don't see options. Now, this is, again, oversimplifying, but if you realize this is kind of where they are, they're existing, they're sad, they're depressed, they're stuck. This is the stuck side. And they got all these valid reasons why they're stuck. So you want to listen and be compassionate and listen to their story enough to get rapport and to get the clues that you need, because what you really know as a medical hypnotherapist is that instead of being the effect of that actual thing that happened or that actual thing that person did to them, we have to, in order to help them, get them on the other side of that, which means they got to be at cause. That doesn't mean blame. Doesn't mean blame. It means they're responsible for their part in that interaction. In the case of the woman was going through the intersection, perfect, and this is from a real client I had years ago. I came up with this scenario. I've added a little to it, but they were obeying the law going through the intersection. The other person ran the red light and hit them years ago, causing all their current problems now that have evolved. It doesn't mean they caused the accident. If you take the blame part out of it completely, it means that they had a part to play because they put themselves in the intersection to be hit. So they did have a part. And if you can get the judgment and the blame off of it, it's very powerful. And by the way, the only way the person is going to be able to help themselves is if they had a part to play in it. So if somebody has cancer, obviously, we're not going to talk to our clients like this. This is for us to know that we got to get them to be at cause. Now, it doesn't mean they caused their cancer. It may have some causal effect based on lifestyle choices they've made. As in someone with lung cancer, they may have caused it partially because of smoking or something else, right? That's not what this is about. It's not about judgment and blame. That's why I said if you can train that out of your head when you're talking to people, what we want to do is empower them to know that because they were there to have this happen to them, because they are here, and that their body has responded to the diagnosis the way it has, if it's cancer or something. Now we're going to help them to be responsible, to take that control, their part that they play in this, to start getting, instead of focusing on all the reasons why they have the problem, we're going to start focusing on, now what results can we start to get? And now all of a sudden they've got some power, they've got some independence, they don't need all that support maybe, although that can get very comfortable. It can get very comfortable on that stuck side, right? They may not be happy there, they probably aren't. But if they're in our office, we have permission to help them get independent, powerful results. And to realize I have a place in this circumstance. Just by the fact that it's happening to me, I have some power, and they can be in control now. They can free themselves. They can be strong, brave. They can act instead of reacting. They can start leading some circumstances to get results. Instead of being constrained, they can start to relax and be more open. That's one thing we help them do, right? Relax, let go of all that tension from being stuck, from being helpless. And they can start getting excited and passionate about, maybe I really can do something. Maybe they can start to see now, because they loosened up and opened up the creative unconscious and taken their power back and their responsibility for what they're going to do with this circumstance. Now they can start to see possibilities. They can get excited. They can start living. They can be joyful, moving and growing, which is our natural state, right? Stuck is not a natural state. It doesn't feel good. That's because it's not natural. So this is the breakdown of what we want them to achieve. Victory, a winner, a conqueror, a victor. Achievement of mastery or success in a struggle or endeavor against odds. Some of the people that come to us with grave medical issues, they're hearing a lot of stuff from the doctors that is pretty serious. And this is my little chart that I made. I talked about pivotal response conditioning, that term I came up with because it sounded really cool for my dissertation. It's basically anchoring and triggering. My little breath with the fingers. That's my pivot point. Every moment is now. The good news is every moment is now. And here it is again. It's now again. So every moment is what I call an energy choice point. Every life event, every moment is an energy choice point right now. The pivot point, you can only make a change right now. So the pivot point, pivotal response conditioning, the longer you go down the victim path, the farther away the victor path gets. That's what this chart shows. Every moment offers the opportunity to pivot from victim to victor, because every moment is now. The more often you pivot away from victim, the faster and shorter your journey to the victor path. So what we're doing with our clients, hopefully, is offering them a way to pivot when they're not in our office, and to keep getting into the moment and shifting their thoughts and their thoughts, which makes their emotions shift back to what can I do, instead of, oh my God, this is terrible, I won't be able to do anything. It's 11:30, so we probably need a break. So this is the path to victimhood. And what we do with our clients is we start showing, they're usually way out here when we get them, and it's a long way back. So we got to train it in first, but then they can start to move down this pathway. And if they get a little bit off course at any moment, it's a shorter trip back, and the mind starts to pick it up faster and quicker. So now they can pivot back very easily. And pretty soon this becomes the new norm. Because victim is not a normal when we come out of the womb, right? Your client wasn't a victim until they got this diagnosis, in the case of working with medical issues. Now they're on that side, and our job is to get them to start feeling that empowered side, that victor side, that side that has the results, and they can be in control and strong and act and get excited and see possibilities and all of that good stuff. So there you go. That's from our hypnosis training. We need a break.